Okay, I would like to introduce Dr. Mahmoud from Egypt. The title is Role of Tumescent Fluid Infiltration during Saphenous Stripping and Ligation of Operation of Varicose Vein to Reduce Post-op Complications.
Good afternoon. Introduction. Saphenous stripping and high ligation is traditional operation for varicose vein globally. Both operative complications like pain, subcutaneous ecchymosis, hematoma, and wound dehiscence are possible. The study to assess rule for ultrasound guided tumescent fluid infiltration through saphenous fascia to reduce complication. Patient method single arm prospective cohort study conducted over 300 cases between February 2020 to February 2022 at 2 hospitals. Inclusion criteria: primary varicose vein with incompetent saphenofemoral and or saphenopubital junction, age over 80 and less than 65. Exclusion criteria: secondary varicose vein due to previous deep venous thrombosis and or iliac vein compression, May Turner, recurrent varicose vein after open or endovenous ablation, surgical high risk patient like ischemic heart, renal, hepatic, and pregnant patients. Surgical technique: surgical exposure of the saphenofemoral junction and or saphenopubital junction through small transverse incision, surgical ligation of the junction and insertion of stripper with counter incision at just below knee, lateral malleus for guest saphenous and short saphenous stripping respectively. Under ultrasound guidance, tumescent fluid infiltration to fill saphenous fascia consists of 500 cc normal saline, lidocaine, bupicaine, and sodium bicarb, then stripping and surgical closure. And this is during infiltration along course of saphenous fascia. Follow-up: the postoperative clinical assessment was done at first day, 1 week, 4 week to assess pain according to visual analog scale score, ecchymosis, hematoma, and wound complication. Result: demography: we have female more than male, 2/3 to 1/3. Clinical picture: we have edema 76, ulcer 11, pigmentation 30%. Pain score: there was statistically significant reduction of VAS score in comparison between first day and 1 week post-operatively. Ecchymosis: there were 52 cases presented with ecchymosis at 1 week post-operative. 35 cases, about 2/3 of the cases, were ecchymosis score 1, that means less than 25 of treated area is covered by ecchymosis, while 70 cases, about 1/3 of the cases, were ecchymosis score 2, that means 25 to 50% of treated area is covered by ecchymosis. All cases cured totally at 4th week with statistically significant improvements. Hematoma and wound dehiscence: 20 cases presented at 1 week post-operative with mild hematoma, 20 cases with wound dehiscence. All were cured at 4 week without statistically significant improvements. Weak point of research: it is single arm prospective. There is no comparison with another group control. The patient's pain score is subjective to patient and couldn't be assessed in an objective manner. Discussion: tumescent solution is commonly used in plastics, vascular, breast surgery, which has the advantage of reducing bleeding and pain. In the conclusion, ultrasound guided tumescent fluid infiltration along course of the saphenous fascia possibly improve post-operative pain score, ecchymosis, but not for hematoma and wound complication. Thank you.
Thank you very much, dear Amr, for the nice and clear presentation.
Are there any questions from the audience? Thank you for being on time. I want to...
Thank you, Dr. Mahmoud, for this, because I know that I was closely following this since we're in the same department. But after all, was it a common occurrence to make a valid conclusion or a meaningful conclusion as far as the hematoma and the degree of pain afterwards? So the prevalence in your series.
Yes, about hematoma, there was no difference between, as regard when you have to do infiltration by solution tumescent, there is no difference. But about the pain score, it was improved.
And one last question. Why do you combine bupivacaine and marcaine? Because we know that marcaine is long action and more powerful molecule
for
than
post-operative communication pain. For post-operative pain. To reduce post-operative pain.
Okay.
I have one question. You perform all cases with high ligation and stripping?
No,
or
no,
you
it's only insertion situation. Actually, my most practice about endovenous laser ablation or radiofrequency. But in some situation, we are doing open surgery, like in huge size with the vein, tortuous, superficial, and so on.
And do you think, what do you think, how many, what is the percentage of these patients?
My practice about 2/3 endovenous laser ablation, 1/3 surgery.
Yeah. I am asking this because in Germany we have still now 2023 around 70% of high ligation and stripping. So what is the number in Greece? Can somebody maybe comment on this? I think it is the highest number in Germany. 70% of varicose cases are performed by high ligation and stripping.
And maybe it's related to long-term follow-up, being there is a recent study in comparison between endovenous laser ablation and surgery, and show the recurrence more with endovenous laser ablation. So the current trend return backward to the surgery, maybe.
I think it is not just about the cost issue. It's capable of using Doppler ultrasound mostly.
So Makis, you told 50%. Some.
In the public sector, it's mainly stripping and high ligation. In the private sector, it's mainly ablation. It's the cost, the main reason driving it.
But we know in US it's totally on the side of
It's probably 10%.
10%. Yeah.
Thank you.
Thank you very
Thank you.
much.